addiction, prevention, recovery.
Welcome to the Recovery Rebirth Podcast.
Hello, everyone, and welcome to the Recovery Rebirth Podcast. I'm Dominic.
And I'm Jillian.
And today's topic is recovery capital. Have you ever heard that term before?
I am aware of it because a prior podcast, I think it was our sponsorship and accountability podcast, and I will link that in the notes. But that was the first time I heard about that. You made me aware of that term, but I'm super curious to learn more about it.
Well, I did some searching, and by the way, Recovery Capital has been around for a long time, for many, many years, talking about it in the addiction prevention, treatment, etc. field. I call it the recovery field.
Mm-hmm.
So in the addiction field, Recovery Capital, first of all, it's not a city, but I did, do some searching on some information, and it's kind of fun to look stuff up. And did you know that Delray Beach is classified as the recovery capital of the USA? Delray Beach, Florida.
Okay, I was going to say, where is Delray Beach? Listeners, well, I guess if you look at the thumbnail, you do know that I'm a redhead. So beaches, I'm not really well versed on beaches.
Well, Delray Beach, Florida touts as the recovery capital, and the reason they do so is because more people go for treatment to addiction than a lot of other places. And maybe it's some sort of self-proclaimed recovery capital. It could be just them promoting themselves, but
yes.
That's not what we're talking about today.
It's not a place, it's an experience?
Correct. Recovery capital refers to basically the resources, the total holistic approach to recovery, the total resources that a person has available to find and maintain their recovery.
Gotcha.
So you look at not just separation from the substance.
Yeah.
You look at the entire person and all the things surrounding it. So you're looking at things like safe housing, physical and mental health and co-occurring conditions.
Mm-hmm.
You look at healthy environments. Are they in a safe place at home? Employment. Resolution of legal issues, vocational skills and education, and also social life and leisure life. So recovery capital builds a holistic approach to the whole person recovering from substance use, because we know substance use is a disease. And it is classified as such with the American Medical Association and so forth, even though we treat it like it's some sort of moral failing or just, it's just a mental health condition. It is a disease that affects the entire body, including the mind. And Recovery Capital looks at how can we get to the root causes of all of the problems that maybe led up to the addiction in the first place.
Right.
So, as you've said in prior podcasts, and I've seen you type it out in our show notes, maladaptive behavior. So we learn maladaptive behavior because we're in survival mode.
Right.
We're trying to, get by. But recovery capital is a measurement when you're going through treatment, and it's becoming more and more prevalent. But it's been around for a lot of years. I'm going to bring up one of my favorite people.
Okay.
William White. And if you haven't heard of William White and you're in recovery, you ought to look him up. He's one of our biggest fans and a proponent of 12-step recovery, of all things recovery, and reminding everyone that recovery is a disease. It's not a moral failing. It's not just the sum of bad choices. William White has been around for a very, very long time, decades.
I have never heard of him, and we do try to use humor, and I don't want to have this in poor taste. My brain went to Walter White, which is the opposite. Opposite, because I just watched Breaking Bad not long ago with my son. I'm like,
Bad,
no. William White
Correct.
would be like the antithesis to Walter White.
So he talks about recovery capital, and it was originated from a couple of guys that did a series of articles and a book.
Okay.
So it was Robert Granfield and William Cloud. And they wrote a book, Coming Clean, Overcoming Addiction Without Treatment.
Okay.
Now that's interesting. I have not read that book, although I probably will put it on my reading list to read it because it sounds interesting. The title alone, Coming Clean, Overcoming Addiction Without Treatment. I'm sure that there's treatment involved in some way, shape, or form, but I think what they're doing is they're talking about traditional treatment where you run into a detox center for a week or so. But I'm speculating on that. I'll have to read the book. But Granfield and Cloud, defined recovery and the assets that a person needs to build recovery capital, which is sustainable long-term recovery. So, Jillian, you might be asking, what are the aspects of recovery capital?
Yeah, I would. I mean, you did kind of touch a bit on the holistic and all the aspects, but let's tell me more. Tell us more.
So you got personal recovery capital, the family and social recovery capital, community recovery capital, and cultural capital.
Okay.
So the personal is probably includes trauma care. A lot of people who are in recovery have dealt with trauma in their life, and trauma triggers addiction. If it doesn't trigger addiction, it amplifies addiction, because I'm not a big fan of the word triggers. I think that was invented in the treatment center world. When I drank and used drugs, the trigger was breathing.
Right.
So if I was awake, I was doing it. And I would say trauma spiked my addiction that was already in place. So it spiked it, caused an advanced level of it. But we look at personal recovery, and we look at food, clothing, shelter. If a person has no place to live, how can they recover? You're going to talk about you're going to talk about somebody not drinking when they're unhoused.
Right.
Are you going to talk about stopping drinking when they can't eat properly? There's no good source of nutrition and food. They don't have proper health care. They have no education, or they have mental health problems. So you got to look at the person first, and then you got to look at the people around them. So the family and social recovery capital. What network of people do they have around them? They say hang out with the winners, right? So you got to have a good network of support, and that leads to community recovery capital, like peer-led support. I'm a huge fan of recovery coaches. Recovery coaches are one of the best job functions that ever hit the marketplace in addiction, and we don't support recovery coaching enough. I know we're supporting it a lot, but it's growing. It's a growing field, and I think we need to pay them more. And we need to value them more in the system, because recovery coaches give consistent support to a person who's seeking recovery, can help connect them to all these resources that they need.
Yes, and we talked about that quite a bit in our episode on sponsorship and accountability. And I like the fact that it's a peer approach, because again, for me, knowing that person has been where you've been and understands, they can relate on a level that somebody who's never struggled with what you're struggling with, like that to me brings a lot of credibility to it, and I trust that person a bit more because I know they've been there.
Absolutely. Peer-led support is so important, because you can't say you haven't walked a mile in my shoes.
Exactly.
You could say, well, I've been through that. I've been through a divorce. I've been through being homeless. I've been through job loss. I've been through relationship breakups. All these different things that people say, well, you have a perfectly healthy marriage. How are you going to talk to me about,
right,
being alone and breaking up with, multiple people, whatever the topic, spin the wheel.
Right.
So peer-led support, usually people have been through the situations, and if not, they have a network of other peer support specialists that have been through the situation where they can get advice on it from lived experience. And,
yes.
And that's something that's becoming more valued as lived experience. But I don't want to get sidetracked too much on that. But the peer support, recovery community organizations that help support the efforts of a person seeking recovery, and recovery community organizations basically provide resources and connect people to resources and provide meetings and more peer support. And also, recovery housing is growing.
Yeah, sober housing and recovery housing. Yeah.
You know what bugs me, though, about that, Jillian, is people still say, well, we don't want those people in our neighborhood. You know, you don't want the sober people. You can't get into a recovery house unless you're sober and working a program.
Yeah.
If you use drugs or alcohol, you're done with your recovery housing. You're kicked out. You're evicted. So why wouldn't you want recovery housing in your neighborhood to have good, productive people working in the neighborhood?
Exactly.
People who work in recovery housing are usually the first one to grab a rake and help clean up the leaves in the neighborhood, you know, and all that. They want a nice neighborhood. Anyway, I digress. So, but the recovery housing is an important component, and that builds that peer support and you know, living in a good environment. And then treatment court programs. Oh, I love treatment court programs. They're a great alternative to incarceration.
Right.
We can't incarcerate our way out of addiction.
Nope.
That doesn't work. People need help, and treatment courts will help them. And also cultural capital. So you've got specific belief patterns. If you're Native American, if you're Jewish, if you're Islamic, if you're Christian. So you have faith-based cultural capital. Or, you know, there's a lot of talk right now about the racial issues in recovery.
The disparity, yes.
Oh, racial disparities in recovery. You know.
Yes, and we've talked about this before, but I can tell you the meetings that I attend, predominantly white, and also separately straight. Like, so there are also groups like LGBTQ recovery groups. I think that's really important because, as we know, there's this. I think it's William What's his?
William Cope-Moyers.
Thank you. Yeah, addiction doesn't discriminate, neither should recovery. And that sticks with me. Like, I heard him speak, that stuck with me so much because I'm like, let me think about it. Like, let me think of those rooms that I sit in. They're very white rooms. They're very, you know, like straight, cisgender for the most part. But everybody is, I mean, it crosses all socioeconomic barriers. I mean, nobody is immune from it. And so everybody should have access to recovery. Okay, getting off my soapbox.
No, you're right. I'm cheering you on. I'm like,
I see your pom-poms.
This is, you know, important. Addiction doesn't care if you're black, white, gay, straight, whatever. It doesn't care. It's a disease that affects, it's like cancer. It affects everybody. But the cultural differences in seeking treatment and access.
Yes.
The cultural differences for asking for help. The cultural differences for actually getting the help.
Yes.
So, and the money available for getting help. You know, addiction doesn't care if you're rich or poor either.
Sure doesn't.
There's plenty of wealthy people that they're, you know, addicted to heroin or cocaine or some other drug. So, you know, addiction doesn't care, and neither should recovery. So we do need to be all inclusive, and that's why cultural capital, building cultural capital, so that people feel comfortable, so that a person of color can feel comfortable in a meeting with people who are white people.
Yeah.
You know, whatever. And I hate that we call it white people. We're pink. White people are pink, and a lot of black people are brown.
I mean, well, people of color is more
but I'm not making light of it. I'm just saying that addiction doesn't care, and we want to be all inclusive. We want to help people.
Yeah, and we've talked about before, and you know, we will get into another episode that delves more into like implicit bias and those kinds of things. But the fact that the rates of addiction among communities of color compared to the, you know, white or the whatever, you know, like to people who, those of us who are not people of color, who don't identify or don't belong to that group.
You
like,
could say white people.
I know, because I mean, yes, I get
until the language police change it again.
It's nuance and it's splitting hairs, but yes. So white people have more access to have lower rates of addiction and more access to recovery. So that is a huge problem. Huge problem.
So building cultural capital and making sure everybody has access to treatment and making sure that people who are in a particular culture or comfortable with a particular culture have
cultural competence,
have the ability to go get what they need.
Yes.
So what are the benefits of all this recovery capital? Well, it sustains long-term recovery.
Mm-hmm.
And when you have sustained long-term recovery, people become productive again.
Mm-hmm.
They get, back on track. I know so many people of all different race, creeds, colors, backgrounds, religious backgrounds. I know so many people over the years meeting them in recovery, and I've watched them turn their lives around.
Yeah.
And they always end up with a better place to live, a better job, better relationships with people, and that is because they are building this system around them. And that sustains recovery. Well, that would save a ton of money. The addiction problem is costing trillions of dollars to the community in the United States, various communities all over the country. So we say we want to not have to throw all this money at it. Well, if we get more people recovered and we sustain that recovery, they become productive and they help other people and provide services. I know also a number of people who are recovered and become peer support specialists.
Right.
So, and also you have improved coping strategies dealing with the problems that do come up in life, because life, the globe doesn't stop spinning just because I stop drinking.
Right. Yeah.
So we're also mindful of increasing resources to marginalized communities, because if we improve those communities, they become more productive as a whole. Mm-hmm. Somebody told me it was like, have you ever heard of the curb effect?
Is it like broken windows?
No, the curb effect is, I think they were talking about making the little dip for wheelchairs to be able to go up and down curbs.
Okay.
And everybody benefited from it, including the people that have wheelchairs.
Gotcha. Okay.
So helping a marginalized community, helping, alleviate all these problems for a person in addiction, and working on building recovery capital helps the entire community. Things get better. So it doesn't just help the one person, it helps the whole community.
Gotcha.
So now that you might be wondering, how do you measure recovery capital?
Yeah. And
there's actually a scale that goes through all these things, and what happens is that people who are in, let's say, an intensive outpatient treatment program or something, hopefully their case manager, their therapist, whoever they're working with, whoever is the person that's assigned to help them, hopefully they're going through the different scales and measuring recovery capital over a period of time, from when a person comes into recovery to when they leave, recovery. I don't say leave recovery, but leave a treatment center.
Right. Yeah.
And continue to sustain recovery, to continue the path.
Right.
So there's actually a scale that measures all this, and what you do is you ask a series of questions, and then you're able to connect them to the resources to get that recovery capital that's low back up to a high score. Mm-hmm. So it's pretty cool stuff.
Wow.
You probably have a ton of questions. Go ahead.
Well, the fact that so you can measure it, it's just because you touched on that in a prior episode, and I think again when we were talking about like funding, because foundations or people, if you're going to seek funding to support recovery, and especially, the goal is to focus on the prevention, right? We'll always need recovery, but if we can have more prevention. That would be ideal, but to get funding for that, they want to see, what do we talk about? Anyhow, so you want community impact, measurable outcomes, the evidence-based research stuff, right? Because when you're presenting, you want the data, and to be able to give that tangible, hard data, like we can actually measure this. Like this isn't just something like some nebulous concept. Like this is how we can measure this.
And that is a game changer for grant money and foundations giving to recovery, because one of the problems that we've had, a big challenge over the years, is getting more funding for treatment.
Right.
There's always funding for prevention,
Yeah.
And the reason that there is funding for prevention is they are filled with data.
Mm-hmm.
They've got all kinds of research and data.
Yeah.
And data is king. You know, you're looking at, when you can look at all these reports and data and show that something works,
Yeah.
then you get money. That's a simple concept, you know. And if you say, well, what about recovery? How do you measure recovery?
Yeah.
Well, I haven't really got anything to show you on that. You know, some
Right.
people recover, some people go to the treatment center 20 times.
But now we do have data because, yeah, like I said.
Now we can actually measure data.
Right. Because I think we will always need recovery as much as like prevention is fantastic. Like we do need to ideally to curb that so we don't have more people struggling with substance use disorder or struggling with various addictions. But the reality is we need recovery.
We need more treatment dollars,
Mm-hmm.
and that treatment should be inclusive of measuring recovery capital.
So are there organizations that you know of in Kalamazoo that are kind of leveraging this data to get more funding? Because I mean, you kind of live and breathe this world. I mean, you're very much involved in recovery. And more familiar with the organization. So is that something that's being talked about a lot in our local community?
Yes, and it has been for a long time, and there are people that are measuring it. The challenge, I won't say problem in this instance, the challenge is that a lot of times people leave treatment and then you lose touch with them.
Yes, there's not that
continuity. They're using paper. And you sit down with a therapist with a piece of paper, and they go through the recovery index, you know, with you, and then it's all done on paper. But now I'm going to, you know, give a little plug for software.
Okay.
There is something out called the Recovery Capital Index. And it provides a comprehensive picture of a person's recovery using an online method, an automated method, and it's still in development. It's still fairly new, but it has been expanded across the country, and people are seeing good results with it. Just like the court system is looking at getting rid of the paper sign-in sheets, they're looking at you know, what can we do with maybe checking in with your phone or something like that in different apps and software packages. The Recovery Capital Index allows you to do this in an online fashion. So as long as the participant inputs the information, they can continue and people can look at the results. So I think the big struggle is making sure that we have a system in place that provides continued data.
Yes, and that was the Glue, right, that you mentioned last time?
Yes,
GLOO.
Glue is one of the companies that's involved, and the Recovery Capital Index, you can actually look them up online.
Yep. I'm going to put that in
They
the
have
notes.
some information, and I know those folks. They're good folks, and they're working to, you know, get this software out all over the country. So it's centered on the person and a easy way to input the information. You don't have to go sit down in an office and fill out 6 pages of, you know, forms.
Right. Well, and we've talked in past episodes too about that continuum of care, right? So after like you leave a treatment center, like that's not the end of the journey.
Oh no, that's just the beginning.
That's the launching pad.
That's the beginning.
I mean, you need that continuum of care. So this is part of that.
You ever heard of Dr. John Kelly?
Yeah, we talked about him previously in that I think sponsorship episode.
John Kelly out of Harvard.
Yes.
You know, did an actual study with data that showed that 12-step programs work.
Yes.
And they work because of the continued follow-up support.
Yes.
And basically this Recovery Capital Index, you know, if you're continuing to measure recovery on an ongoing basis, and there are other ways to measure it, but this is just one. I think I like the idea of online where you could just everybody has a phone. Yeah,
there's an app for that.
So I know people that are on public assistance and they still have a phone.
Right.
You know, so phones are more accessible than they used to be. It's not a luxury item anymore. It's a necessity.
Yeah.
And you can use your phone to input the information.
Yeah.
So if we can track more of this data and grow this, and I think that's part of the reason why we're talking about it, is because people need to be aware. If you work in the field, if you work as a peer support specialist, if you work as a therapist, if anybody's out there listening that works in the addiction field, I suggest you look into best ways, best practices for measuring recovery capital. Online and phone-based would be ideal because that way people of all types can access it easily. And you don't have to be sitting in an office. The more data we can get, the better we can improve the other stuff. Get more treatment dollars, build more treatment centers if necessary, support more better paid recovery coaches. All good things come out of it. But most importantly, you're able to look at your own life. You're able to take a look at your own life and see where you're at and where you want to go. If you're low in a particular area of recovery capital, let's say your social life is suffering and you don't have any friends.
And it gives you resources.
It gives you resources and ways to help alleviate that. So the goal is to get a person whole again.
Yes.
And have a 360-degree view of recovery. I thought of this years ago when I first got into recovery, and then I learned that it's already out there. But I was like, you get sober, and then all these other problems hit you in the face. It's a scary, overwhelming, anxiety-ridden time, in early recovery because all the problems you thought you were avoiding start hitting.
Yes.
So,
because you're not anesthetized anymore.
Right. So this particular podcast is important for people who work in the field.
Yes.
If you're sitting there using paper for recovery capital measurement, maybe it's time to explore better ways to stay more connected for a longer period of time to your clientele.
Nice.
So, any other thoughts?
I'm just really glad that you brought this up, and I like that it's we try to. Our audience ideally is varied, and I'm hopeful that we definitely have some recovery professionals in our listener base. So I hope this was helpful for you. But just anybody who happens to be checking in and learning about recovery options, this is a newer concept to me. So I'm glad to be made more aware of it, and I'm encouraged that there could be more funding for the recovery and the treatment because we have these tangible measures that can be presented. So I just thank you for continuing to enlighten me on this journey and to share it with our listeners. I almost said readers. We do that sometimes with our listeners. So this was just very much this episode has been a lot of me just learning because this is new to me, and I'm excited to share all the resources in the show notes for our listeners.
Absolutely. Thanks, Jillian, for being my co-host for today for this podcast, and we hope to see recovery capital being discussed more and more often, and expanded ways for measurement so that we can continue to provide treatment for a disease that isn't going away no matter what we do. Unfortunately, it's been around for centuries, and we're really taking note of it now with the population that we have today. So thanks for listening, and please check out the show notes and spread this around. Share this podcast with other professionals who work in the field. Let's find some best practices for building recovery capital.
Yes.
Thanks. Have a great one.
Thank you.